Your dog's got an eyelid tumor. Is it serious or not? This is most likely what's going on and what you can do about it at home. Hello, welcome back to my channel. If you're new, welcome. Click there to subscribe. Hit the bell to sign up for notifications, and then when you click the link directly in the box below, I can send you a copy of my free book. Little Tula's got an eyelid tumor. It's located right here on her lower right eyelid. You can see it sort of a little bit knobby. It's right there on the edge of the lid margin. The eyelid tumors, they're really common in our older dogs, and I often saw this in practice. The old guys would come in, you'd see this little bump like we have on Tula's lower lid here. Like a little eyelid tumor. And I'm always asked, like, is it serious or not? Like, what do I do, doc? Fortunately, the majority of these tumors, they're benign. The most common one is called a Meibomian Adenoma. Glands, they're present in the eyelid to provide this extra layer of protection over top of the cornea, the surface of the eye. Occasionally, that gland can turn into a benign growth. Likely that's what Tula has here, this Meibomian Adenoma. Characterizing whether a growth is serious or not, if this is something which is relatively slow growing, which it is, just kind of sort of easily movable at the edge of the skin, it's not painful, in all likelihood then you're much more likely dealing with something that is benign. And that's what Tula's case is here. But if, for instance, it's something that is rapidly growing, it's sort of invasively spread, adjacent to the eyelid, and it's actually, causing increased discomfort for your dog, more likely then that's something that's much more serious. Maybe it's a carcinoma. For sure, you want to go see your veterinarian and likely get that removed. Number one, the hot compress. I'm soaking my gauze into this hot water. It's nice and hot. And what I want to make sure is before I put it on Tula's eyelid, I want to make sure that it's, comfortable to touch. So it's hot. Next, I'm just going to put this hot compress. I've tested out on my skin. We know it's not too hot. I'm just going to put it right on top of Tula's lower lid, right? That's okay, little Tula. I'm going to probably leave that on there for about 5 minutes. I'm going to do that for a minimum of twice a day. Number two, one of my favorite eye remedies. It's a black tea bag. So I'm moistening our Earl Grey tea bag in this hot water. Then I'm going to use this as the compress. Similar to how we use the gauze, we're just using the tea bag. So we're just going to put that right on top of Tula's right eye, on top of her lower lid. I'm going to be holding this for 5 minutes twice a day. So the tea is not also providing the heat, that hot water, which can help maybe break down the gland. Secondarily, there are antiseptic things in the tea, tannins, which can help decrease inflammation, potentially fight any secondary bacterial infection that Tula may have as a result of having this tumor. So, it's soothing, it's super safe, surprisingly effective. Of all the different eye things I talk about, think about using tea way more often. Number three, it's a flavonoid found in green tea, shown to be especially helpful for the eyes, EGCG. The antioxidants, many of the properties found in green tea, seem to be especially beneficial for the eye because they actually concentrate within the eyes themselves. So within the eyelids, parts of the surface of the eye. Say we're dealing with things such as dry eye, like keratitis. But regardless, it may be really beneficial when we've got a dog that has an eyelid tumor, eyelid growth. This here is EGCG, it's 200 milligrams, kind of about a standard dog dose is about 50 milligrams per 20 pounds of body weight daily. Well, I should be getting about a quarter of a capsule. So I would just break it up, I'm gonna sprinkle that onto her canned food. See if she eats it. Eat this. Yummy. Who wants some green tea? What? See, it's always great till you try it in camera. Okay, look, so good for you. Green tea and canned food. Sometimes in practice, we used to use steroids to try to shrink those benign growths. Here's the natural steroid you can consider trying. Herbal tincture, licorice root. The dog licorice root tincture dose, it's about 1/2 ml of the tincture per 20 pounds of body weight twice daily. So there's about 1/2 ml of the tincture right there. And I'm going to try this on Tula. If after 2 weeks of using the tea and the green tea, this little growth isn't shrinking. But that's kind of like, in a couple weeks. This is what the next thing I'm going to try. 1/2 ml twice a day. I'd be doing that for a good 10 days to 2 weeks. See if we can shrink some of that growth, you know, really like shrink down that tumor. Last but not least, for those of you who want to try something really alternative, seems to work for many cases, the homeopathic, nitric acid. This remedy in part comes from a very well-respected alternative veterinarian, Dr. Christine Chambro, who specifically used this homeopathic remedy to treat what little Tula has, you know, this Meibomian Adenoma. As far as a standard kind of homeopathic dose, it's about 1 30C capsule per 20 pounds of body weight. We're doing that twice a day. So here's our 1 little 30C capsule. We're gonna pop that in, little poodle, just into your tongue. She doesn't even necessarily need to swallow it, just want her to absorb that. The surface of her tongue, if she swallows it, that's okay. Your dog's got some type of eyelid growth, you're wanting to avoid surgery at your vet, consider a few of those remedies, and if they help, I'd love to know. Please send me your feedback. Once again, thanks for watching, and I'll talk to you soon. It's Dr. Jones.